morning. Good morning, all of you. Thank you very much, sir, for your kind introduction. And I would like to thank Kandy Society of Medicine for inviting me for this lecture. And so actually, as sir said, that this is one of the confusing topic and trending topic because nowadays, apart from healthcare professionals, almost all are giving advices. There are YouTube channels and social media groups regarding this dieting and obesity management. As a healthcare professional, my view today is to show you pros and cons with the current evidence-based medicine. So this is my declaration. So this is my overview of the presentation, and I would like to touch upon a small detail about burden of obesity, and then what is the principle of dieting, and then the benefits which you all know with scientific evidence, and I would like to touch upon some of popular diets. And then popular queries that you all may have, but we can discuss them after the lecture as well, and then some take-home messages. As you all know, WHO has already declared the obesity is a global pandemic. So when it comes to Sri Lanka, according to the STEP survey, which I have shown here, 25 to 34% are overweight, and so the obesity is increasing in Sri Lanka as well. So it connects to lots of NCDs like diabetes, hyperlipidemia, fatty liver, and mechanical problems as well. So that obesity prevention is a must, and diet plays about 80% role in that, and exercise plays around 20%. And as well as when it comes to the BMI values, we should have, as Sri Lankans, we are having high percentage of fat mass, so we need to maintain a low BMI cutoff. The research article is done, shown that it is proven that we need to have, according to our body composition, we need to keep our BMI in low position. So that is another thing. So the dieting came with this increasing this obesity. So as you can see, there are a lot of groups in social media and YouTube channels, and those things are there for dieting and advice. So this dieting came popular since 2004, and so with that dieting, some diets came like claiming very fast weight reduction. So we call them trending diets or fad diets. The main issue of those diets is the sustainability issues and health issues. I will discuss when we discuss the diets separately. So principles of dieting, like what is the principle of dieting or weight loss? From any diet, we need to maintain the energy balance. The picture shows there is showing the energy balance. If we need to balance the food intake and food energy expenditure. If we take less energy and spend more, we can have weight loss. That is the main concept of dieting or weight reduction. So any diet should adhere to this concept. So when it comes to energy consumption, you can see carbohydrate in healthy adult, carbohydrate should come around 50% of the energy, and protein 20%, and fat 30%. So when it comes to Sri Lankan context, according to the evidence, 70% of energy comes from carbohydrate, and we get only about 18% from oil, where other countries it's around 30%. So our problem is mainly carbohydrate content. And another thing is like the major nutrients are carbohydrate, proteins, and fat. So whatever the nutrient we reduce, the most important thing is reducing the total calorie, not the certain nutrient. That I must say. Then the target. So when it comes to weight reduction, we reduce weight due to health benefits or figure maintaining. But anyway, as healthcare professionals, we need to achieve like 5 to 10% weight loss within 3 to 6 months. So it is a small target. So as doctors, when you tackle patients with obesity, I think you should begin with this. So if there's a patient like 70 kilos, his BMI should, when it comes to his ideal BMI, his weight should be like 50 kilos. So if we say that patient like you need to reduce 20 kilos at once, so the patient will not get motivated and patient will get depressed. So but if you say 5 to 10% weight loss, that is around 6 kilos. 6 kilos in 6 months, you see, it is an achievable target. So that that motivation is more thorough than telling like you need to wait, you need to come to this BMI like that. So that is the most important thing. Then the rapid weight loss is like 10% weight loss over 5 weeks. Like, so those things are done by in certain occasions with close supervision. Then researchers have assessed if we reduce weight rapidly, whether the weight maintenance is low in long term than normal weight reduction. There is no difference like that. Even if you reduce rapidly weight or normal weight like 5 to 10% in 6 months, there is no difference in weight regain in about 9 months. So the weight maintenance is more important. So when it comes to weight maintenance, exercise plays a key role, like 30 minutes per day aerobic exercise plus 2 to 3 times per week strengthening exercise. So that should combine with exercise when it comes to weight maintenance. Then this is the evidence-based benefits of dietary adjustment and weight reduction. If you reduce 10% weight loss, there are strong benefits on glycemic control, like 50%, around 40 to 50% benefits about glycemic control. So that glycemic drugs, when there's a diabetic patient, you can reduce the drugs in about 40 to 50%. And there are reduction in like the 10 to 30% reduction in cardiometabolic factors as well, as you can see, and reduction in blood pressure by 10 millimoles mercury. So this is very important. So we can tell the patients that meantime, when we reduce the weight, we can reduce the drugs as well. So that is another motivation. So when it comes to diets, I would like to talk the diets in two major categories. There are diets like low fat and low calorie. Then there are other diets like low carbohydrate diets. Then some other diets I have mentioned downwards. There are intermittent fasting, vegan diets, then General Motors diet, detox diet, gluten-free diet, and prune diet, soup diets. So I would like to touch upon all of them. Then major diets are like low fat and low carb diets. Low fat diets, when it comes to low fat diet, the normal conventional diet like low calorie balanced diet is there. I will talk about that, which is really old and which we already always practicing. Then Mediterranean diet also comes into this one, and then liver diet or very low calorie diets are there. Then when it comes to low carbohydrate diets, there are keto diets, Atkins diets, then paleo diet. So this paleo diet can come to this, it's same as Mediterranean diet, but since it is very low carb, I put into that low carb diet as well. It is in the mix, in between state. So this is the conventional diet we all practice, this low calorie, low fat diet. We can give the diet by calorie count, but in Sri Lankan context, it's very practical to use the plate method, because most of our foods like calorie composition and things are not that assessed as in Western countries. So plate model is a very convenient way to convey the message to patient. So this is the plate that we can use in Sri Lankan context. So it's around 1/4 rice, then vegetables around half, and then another quarter protein content. So in this diet we try to increase some protein content, rather not that in keto Atkins diet, but slightly increase the protein content to improve the satiety, and as well as increase the fibers by salads, including malung, and we include healthy snacks. I'll show. So this is evidence based one, like this one of the research done in Sri Lanka in cardiology board, that plate metal is a very good method to convey diet to patients. So this is done in Colombo. This is a sample of diet. I put it for your more understanding. So that is the sample of low calorie, low fat diet. So early morning for the tea, I put non-fat milk with 1 teaspoon of sugar, and then for breakfast, boiled chickpea 1 cup with lumiris, and then mid-morning snacks I have put cashews, banana, yogurt, healthy snacks. Then for lunch I have put usual traditional rice meal, and for dinner boiled vegetables, brown bread, and some proteins. So I would advise this kind of diet for an example around 50 years old lady coming with all metabolic obesity and metabolic syndrome, not eating that much, like 3 or 4 cups of rice, but eating like 2 cups of rice when we assess the dietary record. And then if she has not tried any other diets before, newly come to us, so I would give this kind of diet. So likewise we need to tailor make that one. So I just set an example. So these diets are very healthy and long term we can continue, and as well as it covers most of the food groups as well, no health issues. So then the next diet is Mediterranean diet. So this is the evidence-based cardioprotective diet. It has evidence for about 5 years trials, and it has proved effectiveness in many chronic disease other than cardiovascular disease like Parkinson's and those things as well. There are no adverse effects identified as well. These are the trials that have put like seven countries study, Peradeniya trial, Dietary trial. So all these trials proved that this diet is really effective to improve cardiometabolic risk factors and healthy. And this diet was introduced by Ansel Key, and he has noticed the low cardio metabolic risk factors around the Mediterranean Sea, like in Greece, Greek people. So according to those lifestyles, he has made this diet. But the problem with our setting is this diet use wine and olive oil. Olive oil is the prime source of oil, and they use brown bread and whole bread, like if in our context, like whole rice, red rice, like. And they use fish and poultry. They don't use much red meats. So our problem in our setting is we cannot afford olive oil. Even we can afford our cooking system. We cook usually with oil, but here olive oil should take in raw or sprinkle with foods, so that it's very difficult to practice in our setting, even though it is very healthy. Then the other diet is like the low calorie, low carb diet is like liver diet or VLCD diet. It's really low calorie, less than 1000 kilocalories. Actually, we use these diets for surgical patients, like patients who are awaiting cholecystectomy or bariatric surgery for about 1 or 2 months to reduce the liver size, and as well as to prepare him for the surgery for anesthetist benefits and those things. So we need a quick weight reduction. That's why we use these diets. If you can see the sample of this diet, very limited options. Only 3/4 cup rice is given, and much proteins and healthy snacks are given. And dinner, of course, we replace it with high fiber nutrition supplement. So it is evidence based. So these diets actually we cannot continue more than 12 weeks. These are for specific patients. This is also healthy, no side effects if we limit these diets to around 3 months. So low calorie, low fat diets are finished. Now low carbohydrate diets. These are also very popular in the system, like ketogenic and Atkins diet comes. So we'll talk about ketogenic diet, and so it came around 1923 as a treatment for epilepsy and neurological diseases. So this now the normal composition of the plate. Daily meal, like carbohydrate should come around 50% and protein 20% and fat 30%. But down there, the circle shows how the ketogenic diet works. The carbohydrate contents come to 5 to 10% of the energy, and protein same as normal, 20 to 25, slight increase, and fat percentage has increased double or triple. So that's the basis of ketogenic diet. So these are some plates, one of the Sri Lankan plates and things. So you can see that in Sri Lankan plate, we haven't included even rice. Because we include vegetables for carbohydrate source, only we can give 5 to 10% of calories from carbohydrate. So these vegetables also contain carbohydrates, so that we have to omit rice. And we have included proteins with omelette and proteins, and as well as oil we use to fry omelette, and also pol sambal and those things. And the other picture is a Western type of ketogenic diet. They have included proteins, and they also haven't included any carbohydrate, those staple foods, and they have included some avocado, those things as well. So ketogenic diet, what happens is low carbohydrate. When there's low carbohydrate, it induces gluconeogenesis, and then we get low insulin with low sugar. So insulin is a genesis hormone. So when there's low insulin, the fat genesis is inhibited. So that is the basis of weight reduction. So the benefits are it's neuroprotective, especially for refractive epilepsy. We practice in cinema for those children, and it is the weight loss is evidenced more than low fat diet. It improves glycemia, and sometimes it can reverse diabetes as well, and it has more effect on triglycerides, and it can improve inflammation, improve CRP, those things. And the drawbacks are like it can increase LDL because we introduce more fat and total cholesterol, and it has short-term effects like nausea, lethargy, hypercalcemia, kidney stones, low vitamin D, those things. This is one of the examples that I have made according to Sri Lankan context. We are giving for patients. This is one of the example of ketogenic diet for your understanding. So for morning, I have included coconut kanji with the 1 tablespoon of oats rather than rice, and I have included a protein powder as well, because kanji doesn't have protein. Then for breakfast, I have included omelette with 2 eggs and 1 cup of vegetables and 2 tablespoons of oil to fry that one. Then for mid-morning snack, I have included avocado and sesame, which is again high in fat. And then for lunch, rice only 3 tablespoons, and vegetables 3 tablespoons only, very small amount. And protein content is bit high, 60 to 90 grams, and some sambal and gotugala sambal and some other oils as well. So this type of diet actually you can say that it's not satiating, but it's satiating because of the oil and protein content. Patient can tolerate it. Then for evening snack, I have included peanut butter, cheese, nuts, those options, and night boiled vegetables stir fried with oil and grilled meat or fish. So that's how the ketogenic diet goes. Then the Atkins diet, the other low carbohydrate diet, popular diet. This is not that popular as ketogenic diet. The main difference of this diet to ketogenic diet is it has a very high protein. That is the thing. Otherwise, the carbohydrate content is such low, like 5% of the calories. and fat is also high. It's also high in ketogenic diet also. The main difference is high protein here. When it comes to Atkins diet, we sometimes practice in some patients. We practice these diets like patients with diabetes and exhausted with low calorie diet, previous dietary attempts and failed patients. We can try these diets, and of course we have to start it in few phases, like first 2 weeks very low carbohydrate, then gradually increasing, and then transfer it to the maintenance diet. So when we practice, we have to do it stepwise. So Atkins diet actually benefits are same as ketogenic diet. It has more benefits on diabetes, even reversal of diabetes, glycemic control. There are side effects, more side effects than ketogenic diet, because we include more proteins here. So the side effects, I have included some articles as well. The kidney stones and metabolic acidosis, dehydration, and the renal stone is the main problem. Actually, the Atkins also died due to renal failure, who introduced this diet. I have made a comparison with low fat or low calorie conventional diet and low carbohydrate diet. So when it comes to the evidence, the low fat diet, the conventional diets, has moderate success compared to controlled eating. It is proven by a famous look ahead trial. And very low, if you give very low fat diet, it can dissolve even cholesterol plaques. That is a benefit, and it has good benefit on metabolic profile. It reduce LDL, increase HDL, so those, and moderate decreasing triglycerides. So, and they are healthy and balanced nutrient wise. It is very healthy. When it comes to low carbohydrate diet, it has more effect on glycemic profile, like HbA1c, diabetic reversal, those things, and moderate effects on metabolic profile as well. It can increase LDL because we introduce high fat, but it has more effect on triglyceride reduction as well, and also fatty liver reduction as well. It has more weight loss than low fat diet in short term, not in long term. But the problem is sustainability issues, and we introduce high proteins, and the patients may not afford for high proteins, so those problems are there. And when it comes to the Atkins diet, they can have renal function and kidney stone formation and lack of nutrients. Those are the problems in those diets. So those are the major types of diets. Then the other popular weight loss method is intermittent fasting. You may also have practicing it, but it's actually evidence-based intermittent fasting. It's a scheduled eating. It is you get a eating window, and then you get a fasting period. So that's the basis of that. So there are various types: 16, 8, 5 to 2. Then you can fast alternative day. Then some patients are depending on 1 meal per day. So up to that extent, we can practice intermittent fasting. So the benefits are, it's also very effective in improving insulin resistance, and it has impacts on appetite as well. The patients who are fasting has low appetite, and it has improved beta cell functions according to the evidence, and it has fatty liver benefits. And weight loss, there are only short-term studies up to 9 months, and so it has effect on obesity hormones as well, leptin and adiponectin. So these are the evidence. All evidence say that intermittent fasting has a good effect on especially glycemic profile and weight loss as well, but we don't have long-term studies, and as well as sustainability issues are there. So these are the drawbacks, like it induces lipolysis and increased free fatty acids. And we don't have long-term trials as well. If there are any questions on intermittent fasting, we'll discuss further. The basic thing is, like, we fast around, for example, 16/8 is the most popular one. We take evening meal around 7 p.m. and we fast up to 12 noon. and you can take any fluids without any calories during the fasting period. Water, uh, coffees without sugar, teas, things, and then you start eating around 12 p.m. and eating also, of course, if you need to get a good benefit, you can't eat as you wish. Like if you need to have a control eating, like reduce the portion of the carbohydrate and those things to be considered. Like you can't eat more fatty foods and fast foods. You need to have a control eating up to again 7 p.m. Then again fasting. Within the fasting period, you can have hydration. So that's the basis of intermittent fasting. Other diet for weight loss is vegan diet, the vegetarian diet. So vegans are, there are several vegan types like lacto-vegetarian, lacto-vegetarian, ovo-vegetarian. So according to the names that you can see, lacto, they take dairy products and eggs. Lacto-vegetarian, they don't take eggs. And ovo-vegetarian, they take only eggs, no other products. Pure vegans, they don't take anything, only the vegetable products. So there are several researchers effectiveness of vegan diet for weight loss. According to the population studies, most have observed that vegans have good lifespan and as well as reduced BMI than non-vegans. So there are around over 5-year studies, so you can see them. The good points are less toxins and reduce cancers, and life expectancy is increased, and good you can maintain the BMI. The most important thing, you can maintain the weight loss as well, and it has improved cardiometabolic profile as well, because when you take animal fats, you get saturated fats and nitrates, those things as well. When it comes to the drawbacks, vegan diets are low in calcium, zinc, iron, vitamin E, and especially B12, and also essential fatty acids. So if you practice vegan diet, you need to take them as supplements, and so those are the drawbacks. Then paleo diet, it is the diet which was practiced in Stone Age. It's also as Mediterranean diet. It also derived from by seeing the normal habitants who are practicing these diets. So it improves health and cure diseases like obesity, cardiovascular disease, diabetes, cancer, and osteoporosis. So there are no restrictions of consuming lean meats, fruits, and non-starchy vegetables. They don't consume bread, rice, and those things, but they only for carbohydrate sources they take non-starchy vegetables, fruits. Then they don't consume dairy products, milk products, and legumes like legumes and cereals. As I said, they don't consume those staple foods. Only vegetable, fruits, and lean meats. No dairy products, legumes, or cereals. They don't consider on portions or calories. They eat those things liberally. So still there are good weight reduction, like healthy weight reduction, like 4 to 6% weight loss in 3 months, and it claims like improved digestion as well, because we don't consume more dairy products. So it is good for health, gut health, and most importantly, it has sustainable weight loss. So the negative effects is, there's a study also, 2 years trial also. So negative effect is low calcium. The diet can reduce the calcium intake around 50% of the requirement. So we need to supplement calcium, and nutritionally unbalanced, and it is costly when you go to practice it, because we need lean meats, those things, and because we don't take staple foods, we need more vegetables, those things, and it has reduction in HDL, which is not good, and increase in LDL and total cholesterol. So more about this diet, that you can see what to eat and what not to eat. Usually staple foods are not consumed, only fruits, vegetables, and fish, meat, those things. And when you they don't consume processed foods as well, packaged foods, and with the foods with sugar, sweets, those things as well. Then other types of diets are detox diet. I think this is very popular. This General Motors diet, 7 days diet plan. First day you take, sorry for the picture. First day you take only fruits, and then second day you take only vegetables, non-starchy vegetables. Third day, like that, there's a plan. If you go to Google General Motors diet, it is a 7 days, and it claims that it has weight reduction of 5 to 6 kilos in 1 week, like very fast weight reduction. And it is proven, it is proven in individual basis as well. There are blogs regarding this General Motors diet. um, so good points are it has fast weight loss, and it has detoxification effect as well, and it has enhanced skin appearance as well. It has to consume more fruits and vegetables. The drawbacks are lack of nutrients, dehydration, and there are not sustainable as well. Only 7 days plan. We have to move into a healthy diet otherwise. So, and we don't have scientific evidence for that. I couldn't find any trial for that as well, in trial or any research on this. Only the individual experience. Other detox diet, just to touch upon that, some people take lemon detox, lemon juices throughout, and gingers, so those things for snacks and things. So there are weight reduction, but these diets are liquid based mostly and low calorie, really low calorie. Because of the low calorie, because they take only these liquids and juices, we get weight reduction, very fast weight reduction, and nutrient poor, especially protein content is poor. So these are the drawbacks. No evidence. Ketosis, dehydration. Then recently, gluten-free diets are very popular for weight reduction, especially among celebrities. This actually gluten-free diet is introduced for celiac disease, treatment for celiac disease. Of course, in celiac disease patient, when we introduce gluten-free diet, they get weight, they gain weight. But when normal people practice these things, they eliminate the things that are shown upper part of the picture, like rye, beer, barley, wheat, and those products as well, and some vinegars, sauce items. So basically we try to avoid fast foods, processed foods, those things. So that is the reason we get weight loss as well. So we can take rice and millet, those things we can take. The downside things, vegetables, fruits, and fish, meat items, those things. So there are trials that the body mass index is low in patients who are practicing gluten-free diet. Then small note on other diets, prune diet and soup diet. These are also popular, and some patients come and ask. This prune diet is like we practice normal low calorie diet, like for main foods, main meals. Then for snacks, they take prunes. But in Sri Lanka, it's difficult to practice here. I have put the amount that to be taken per day. For female, around 140 grams, and for males, around 170 grams. So researchers have shown that 2 kilos weight loss and 2.5 centimeter waist circumference reduction in 12 weeks. So it's a good it's a moderate weight reduction. Prune has an effect on weight reduction because it has effect on appetite as per evidence. Then soup diets. Soup diets, of course, like especially cabbage soup, for about 2 to 3 meals per day, like they take only soups, and then small amount of other foods are allowed, like whole grain, a small 1 cup of rice, like, and then fish, lean meats, nuts, and seeds, those things as snacks. So soup diets also are popular. Actually, when it comes to I have mentioned the liver diet or VLCT diet. It's kind of a soup diet, I can say. Like we replace the 1 or 2 meals with meal replacer over soup, and we allow small amounts of other foods. A few queries that you may have, like about coconut. Coconut, of course, increasing saturated fat. Definitely 90% of saturated fat. Saturated fat increase LDL. LDL causes LDL is not good for cardiovascular health. So that is the evidence. When it comes to other saturated fat, when we compare coconut with other saturated fat, coconut has increased coconut increase HDL as well. So that is a good point. So when you what my advice is, like, we can't avoid coconut in our diet. So we can use a small amount of coconut and take lot of water and blend it and use it, rather than separate it into a diluted milk and thick milk like this. So I think that practice is more convenient. Then about eggs, whether eggs can increase cholesterol. Uh, Researchers have found that 1 or 2 eggs per day, no association with cardiovascular disease, especially even it contains around 300 milligrams of cholesterol. It won't increase blood cholesterol as such. There are 10 RCTs uh, uh, about more than 2 months duration. So we can safely take 1 egg per day. Then rice variety, whether to take brown rice or red rice, those things. No much difference in glycemic index or the benefit in terms of weight reduction. So you can take any rice, but the portion control is the most important thing. Uh, but I would advise some traditional varieties like Purulutuda, those things, for some patients, resistant patients, because those varieties, when we eat, we get more filling, and they are not very tasty as well. So that those things can be incorporated into our practice. Uh, then um, uh, then about taking water before meal or after meal, whether there is a effect on weight reduction or improving satiety. That is a question which is commonly asked. According to the Cochrane review, there is no such benefit. Even if you take water before meal or after meal, the satiety won't improve. But there may be individual effects. You can feel that you get satiety. So it is only the individual experience. Then herbal teas and supplements, no conclusive evidence that they cause weight reduction. When it comes to those supplements, there can be caffeine. Caffeine can increase metabolism, and there can be little effect. Then laxatives. Laxatives actually act on large intestine, not on small intestine. So it can cause temporary fluid loss and temporary weight reduction. There is no evidence that it can improve weight loss. So my take-home messages. So weight loss, the target would be 5 to 10% for health effects. So I would suggest to start with this with the patient. Like, it's a very small amount, like 60 kilos patient, 6 kilos, like 9, even patient is 90 kilos, only 9 kilos for 6 months. So that is achievable target. So patient get motivated by that target itself. Weight maintenance is key. Need to do exercise as well. All diets cut calories. Nutrient source may be different. That is the thing I was explaining. The fat diets, like most diets I have explained, claim fast weight loss, but issues in weight regain and weight maintenance. But there are instances that we can practice these diets with close supervision, and then tailor-made plans are necessary. Especially before giving a diet, we need to take detailed history, how they eat, and what is the 24-hour recall, how frequently they are taking fish, meat, things, those things, beliefs, those things. So it takes time. So other than that, we can't give just a plan. Then continuous support and behavioral strategies are very much important in weight maintenance and weight loss. Thank you.
Thank you, Evone, for an excellent talk. I'm pretty sure you have more questions to ask as well. So for you, thank you for the literature.
Yeah.
I have a question. We all believe that the Western literature, the Indian life,
Vegetarian.
we believe that's the best life one can have.
Yes, sir.
But as you mentioned, the main drawback is that we got availability in certain good like olive.
Yes.
But we have to think of the substitute, what we
Yeah.
have with omega 3. So our probably the olive oil is probably the same omega 3 is a avocado. You can as either avocado oil or maybe as a fruit. As a world, healthiest fruit seems to be.
Yeah.
But we are probably underused. So instead of olive, we can use avocado. So you can say benefit even with the molecular structure, it is more benefit than the probably olive oil. Second thing is herbal products.
Yes.
Let's say it's a bit of underutilized. As you said, there's a very clear evidence. But the Western, they are thinking and they are practicing, see whether they use more and more cinnamon. It seems to be the more cardiac friendly. Instead of probably the caffeine or maybe probably the cinnamon drinks. And for liver, they use the probably the curcumin. Curcumin is more liver friendly. And the probably like that. So we need more and more studies to look into this because our conventional diet. So when you are used like meat and things, our traditional diet, we use sort of spices. It's like we don't know the ability. Now we probably underuse. So we need more and more studies regarding these spices. Western probably will use that as now these products. Thank you, Dr. Both, for your contribution. So anyone else have any questions? Thank you, Evone, for the excellent lecture. Now, traditionally, when we cook, we use, as you said, cinnamon, karapincha, goraka, and veracity. Nowadays, we have seen that there are a lot of publicity. Now, goraka churn and sort of or karapincha, and then it's rather than putting into small amount into the curry, rather than putting that small amount into the curry, eating in bulk. Have you studied that?
No, sir. At the moment, we don't have local studies on that, sir, especially this karapincha juice and things. So it claims that it is not. Some evidence are there that it is not good for liver health in long term. But especially like goraka and things, there are no studies as such, which is done like in clinical settings or public settings.
Yeah,
Dr. Krasner, that Goraka, garlic, and Karapicha put together, they use it in Ayurvedic medicine to treat arthritis. Their objective is to make that person lose weight. So now at Karapicha, they have studied that and they are showing rat models that it reduces lipids as well as sugar. So now chemistry department Peradeniya, they are trying to replicate it on humans. So now the compound is being prepared and they are they are finally finalizing because making a powder is not an easy task. So later we are planning to do it as an RCT on humans. So we will be studying it on patients with pre-diabetes as well as diabetes. So probably another 2 years time you may get some results out of it.
Any questions from the back side? I'm pretty sure you have questions. While sleeping.
Thank you, and you have good lecture. My question is, are there any place in low-fat diet beverages? I mean, is there a place for alcohol in India? Are there places for alcohol in low-fat diet?
No, actually, we don't encourage, but social drinking with the limits like 2 units, up to 2 units, like in terms of social drinking, we can have, but continuous like daily drinking, we don't encourage in low fat diet because it can increase weight, because with drinking you take bites and oil food, so that can increase weight. Yes. Yeah, air frying is best, madam, if we can practice. Air frying, grilling, and baking are good cooking methods, rather than deep frying and just cooking in pots. And of course, we have to advise patients about cooking methods as well, like to avoid deep frying and to use non-stick pots and pans, because it needs only a little amount of oil. And especially tempering in the sense, like even if we fry dry fish, we can fry with we can cook with water, little amount of water initially, and then when you turn off the fire, you can put some olive oil or other good oil. So that's a good method, rather than putting dry fish into hot oil. So those things we can encourage. Uh, um, no, actually, you can't use olive oil, madam, because yeah, you can sprinkle some coconut oil, because the amount is really less rather than frying. But you can't use olive oil. Olive oil is really good for tempering and as raw material.
Thank you, Evone, for the wonderful lecture. I have two questions. What is your take about colacanth and the
Yes.
barbecue?
Yeah, colacanth, of course, it's high in calorie. Colacanth, of course, high in calorie, high in fat and carbohydrate as well, because we use rice and as well as coconut milk, and it is very low in protein. Usually we encourage colacanth, those things for weight gain menus. And when you use weight gain menus also, I usually include protein powder, otherwise it's not a good meal. For us as a snack you can take, otherwise with lack of protein you can't encourage it as a total meal without a protein powder. uh, there are commercial preparations, madam, especially when we prescribe diets for patients in hospitals for weight gain. So if the patient is in liquid diet, we can surely encourage coconut kanji with colacanth. But to improve the protein intake, we can add some protein powder to colacanth. So it won't alter the taste, but it can improve the protein content.
Evone, thank you for
Bar-
the
barbecue, so actually we fry fish and meat and those things in oil for long duration, but the oil amount, I can say it's less, but there can be alteration of the oil composition, making more trans fats. So barbecues are not encouraged regularly, but once in a while.
Well, thank you for that excellent lecture.
Yes.
And so these days, the main problem that I encounter is when you advise patients on diet, they say that they can't afford most
Yes.
of the advice that we give them because vegetables are expensive. So, have you all thought of any method where we can advise the same this thing, but using some new things which will have low calories instead of the conventional vegetables,
Yeah.
certain things that people wouldn't have thought
Yeah,
of?
we have thoughts, and we have made some books as well from our society association, and those are for actually weight gaining diets. For weight reduction diets also, we can use readily available, locally available fruits and vegetables, and then as well as like kollu, rather than paripu, we can use kollu. So the kollu are available in certain parts of the country. So likewise, then we can encourage small fish rather than big fish. So those options we can advise them. Of course, we need to think about that part as well in this crisis.
So they have this the issue that raised by the same day because the barbecue, I think not only the barbecue, I think you see them when you are shopping or oil. Only when you are using the oil, there are a lot of transfer because through the preparation. So when you have to see how the dish is prepared. You see the soya oil, you see the canola oil. When they are manufactured, so they expose the temperature of 170 to 230. So no point of down even if you don't cook, only the export that type of a temperature. So that's why that you select the oil, save and it's a simple method, like a coconut, simple precision you can make the coconut oil. Sesame oil, simple precision and mechanical thing you can make. But most of the commercially available oil, they are extracted either in the high temperature or maybe the chemical. They use the hexane. So because of this high temperature and the chemical extraction, only when you are keeping for maybe 20 days in the sunlight, cannot be transferred. So that's why not only the rainforest, we all need to say not only think about the smoking point of oil, but we have to see how it's prepared. Most of the commercial available oil is exposed to high temperature. Thank you very much. I think